You're in a hospital room with a bunch of monitors and beeping. There's equipment laying everywhere. You hear the nurses and doctors talking outside your room. There's a cold stiffness in the air. In the middle of it all lays a loved one of your own, lying in the middle unconscious on a bed. You've just received the most devastating news you can imagine. They're not going to make it. They've become terminal. You're feeling this massive rush of emotions and pain, and you are now left with the overarching and looming question. What's next? While no one can truly understand the pain and aching that comes in a situation like this, without living it, you're still left with a multitude of options, such as basic end-of-life care provided by hospitals. You can pick for hospice, palliative care, or in a potential future, opt for euthanasia. The ethics between patients and physicians go back a millennia, starting back in ancient Greece and ancient Rome, where doctors swore by the Latin phrase primum non nocere, which means, above all, do no harm. Although doctors followed these rules for many years, they always opted, under certain circumstances, to end a patient's life prematurely. They had a horrible infection, there's no chance of them making it, they would end it. Later, when modern medicine became more available, many countries outlawed medically assisted suicide, as seeing it as it was unethical and cruel, and going against that first rule, above all, do no harm. But in recent years, it has now gained speed with new laws being created, new court cases becoming apparent, and the overall public opinion has shifted towards self-autonomy. This has led many foreign countries changing laws such as Australia, Canada, and the Netherlands, which allow terminally ill patients opt for a shorter life than a lengthy one filled with suffering. A few states around the U.S. have also allowed it. This discrepancy between the states and federal government has caused the subject to become a little touchy within certain groups. I believe no family or person should have to be put in a situation of watching their loved ones suffer, and they should have the ability and self-autonomy to decide when they think it is right for them to leave this world. There are many perks that can be inlaid with PAS, such as the ability to provide relief to a life with no quality or ability. Many individuals facing terminal illness or an advanced stage of a disease, the pain they experience may become intractable, meaning it cannot be relieved or managed through medical intervention or any medication. Since they cannot be helped with medical intervention, the only seemingly permanent relief they would be able to find would be an eternal rest. With that being said, euthanasia would allow them to find this peace and relief a lot quicker than waiting out their life sentence. In my personal experience, I had a close family friend of mine. She had been told she had developed cancer starting in her lungs, which slowly developed into her blood and spread everywhere. She was told she was not going to make it through the upcoming year. In her last probably 6, 7, 8 months of life, she was in excruciating pain, constantly suffering, unable to perform the most basic of human functions without any help. She could not eat, she could not go to the bathroom, she could not walk, she could not do anything on her own. In the end, it did not matter how long she had, because she had succumbed to the pain and grew tired of the suffering on her own. She later killed herself in her own home, to be found a week later. No one or family should have to go through the pain of losing their own life or a loved one's life through a slow and painful process. They should have the ability to leave this world on their own terms when they are ready. This is not the only example of this happening. In a study done by Lancet Health, they determined the suicide rate of people who have been diagnosed with a severe health condition is over twice as high as a regular person. In this study, they used a cohort of 47 million people used by medical records and census reports. I highly recommend looking into this report if you're interested in this topic, of course. Along with providing a relief, it can also lower healthcare costs significantly. As stated in the New England Journal of Medicine in the entry, what are potential cost savings from legalizing physician-aided suicide, by Ezekiel J. Emanuel, MD, PhD, and Margaret P. Batten, PhD. That approximately 30 to 40% of healthcare costs comes in the last month of life and results from the intervention of death. With these numbers, we can calculate the estimated savings using PAS. For the ease of math, let's say someone terminally ill is about a month out from dying. which is approximately the average time spent in the hospital for end-of-life care in the U.S. For that last month, it is estimated by Arcadia Healthcare Solutions, it cost on average $32,379 USD to stay in the hospital for that last month. While if someone in the same position opted for PAS at the beginning of the month instead of end-of-life care, it would cost roughly $3,000 to $5,000 for medication. An exact number is not completely known because it really does differ. Then you would like to spend roughly $519.08 on average for a specialist to administer the drug. This totals to around, on average, $4,519.08. With that much of a significant difference, it would be roughly 14% the price of end-of-life care, which means that PAS is roughly 7 times cheaper than opting for the end-of-life care. And it should definitely be mentioned that PAS is not covered by insurance because it's not deemed legal or illegal, so insurance will not cover it. While with a hospital bill, the insurance would cover roughly 80% on average, which would leave you with about 20% of that cost, which 20% of $32,379 would be roughly $6,475.80. This would be an out-of-pocket cost, which is still more than the PAS cost. With this financial difference, it allows for families to have the financial security and the rest at ease, knowing that they don't have to go bankrupt in order to provide a relief for their loved one. And relief should be what all families are looking for, because in the end, it is up to the family. In fact, many people claim PAS should not be legalized because of the existing palliative care and end-of-life care through hospice. This statement alone is just a fallacy or a false dilemma. As with the existence of patient autonomy, PAS is just like those, another option. It's not like someone who is diagnosed terminal illness must take the route of PAS. There are still many options available, and the family should be allowed to pick whichever route they deem suitable for the situation and the patient. In most situations, I'm sure the family will not pick PAS, but for those times when someone is suffering so bad they cannot find relief, and the only option they have for relief is the end of life, they should be able to have that as an option. In the end, it really does only rely on what the patient wants, and if they want a natural death, they might opt for palliative care. While if they want to get it over with and find that relief, they might go with euthanasia. In the end, they could really end up picking both. They could opt for palliative care and then opt for euthanasia. The overall point being, the options are not exclusive. You don't have to stay with one or the other. You can bounce back, you can opt for one and not the other, but it does not matter. It is ultimately up to the family and the patient. In conclusion, PAS provides liable relief to the family and the patient by giving said patient their own self-autonomy. It allows them to decide their own life choices and when they get to leave this earth. It can provide physical and financial support to all involved with the family in this tragic time. The best way that this idea can be implemented is through a federal law legalizing euthanasia. But I do believe this federal law needs heavy regulations to keep it exclusive to patients with no quality of life or terminal patients. The biggest regulation this law would need is informed consent to not only the patient but also the family members. The best way people can get behind and support this idea is by looking into the many organizations that are pushing for such a federal law. I highly recommend the Deathwithdignity organization. They have many news articles and it's updated daily, and a lot of information is also available for the legislative side of this controversy. Which leads us back to the question we started with. Now what?